If Proposition 3 passes, next year when you stock up on non-food items like dog food in Utah, you will pay more. Voters in Utah will have to decide whether a 0.15% increase in sales tax on non-grocery items is worth the benefits claimed on the Medicaid expansion initiative known as Prop 3.
Those folks on Medicaid would also be paying for that as well. I think that's important to remember, that they also will be taxed.
According to the ballot proposal, the expansion would open up the doors to an estimated 150,000 newly eligible individuals under the age of 65 who are at least 138% below federal poverty. The changes could help out a majority of the clients at Family Health Care in St. George, who make less than $17,000 a year.
So we have about 51% of our patients are uninsured, and 80% of our patients are earning under that poverty level. And so it would greatly impact, we have 14,000 patients, so probably about 12,000 people just here in St. George and Cedar City.
But opponents of Prop 3 argue the initiative is bad policy. They claim the full expansion under Obamacare takes away the state's ability to change or modify the program.
In the state of Utah, as with other states, we have to balance our budget. And we feel like a move like this to do full expansion of Medicaid basically says, here, you can now have control of our budget.
Utah already spends $17 million on Medicaid. Opponents state that Utah would have no ability to limit enrollment or implement cost controls or the extent of use by patients.
And we feel like if we completely expand Medicaid, there are a number of people who are able-bodied adults who could be working but are not, who again have another incentive not to go to work because we're giving them full health care benefits.
33 states have already expanded Medicaid, accepting those federal dollars. Utah is one of at least 3 key states that proponents have targeted to add to that number this election. The Fairness Project is the largest donor financing the committee Utah Decides Healthcare, spending more than $2.7 million in support of the initiative. The initiative contains a tax increase on Utah families of $90 million annually, amounting to nearly $1 billion over 10 years.
I have very little confidence that over time it's not going to be far more than $90 million. And where we have to balance our budget, I just don't think that it's smart to give the federal government control over the state budget.
I think it's really hard to project right now what healthcare is going to cost in 10 years and what we're going to be able to do as a state in 10 years to help cover that cost. I think right now we need to look at what we need to do today.
By bringing home 9 federal dollars in for every state dollar spent, they say it will create around 14,000 new jobs and provide a $1.7 billion economic impact.
And again, those folks end up in the emergency room a lot. And if they had insurance and had access to care, and we're shifting that idea of where to get care from the emergency room to a family practice, we feel like that would really save the system money.
But if it passes and more people begin using it in the system more often, state leaders are concerned about having to pay those costs from other budgets when the deficit becomes too large.
Estimates are that we're going to end up at 40 or 45% of the state budget for the Medicaid program if we go to full-blown expansion. So yeah, that makes me extremely nervous.
It will ultimately be up to Utah voters to decide this election. Melissa Anderson, Community Education News.